the go ahead with the welcome and introduction.
Sure. Hello and welcome everyone to Season 5, Episode 11 of Gateway Center of Excellence in Rural Health Virtual Lecture Series. Today's date is June 3rd, 2025. The topic is the Southwestern Ontario Isotope Coalition, Our Isotope Advantage. My name is Grace Allen. I'm a high school co-op student acting as a research assistant at Gateway Center of Excellence in Rural Health. Gateway is a community-based not-for-profit that aims to promote the health and quality of life of rural residents through research, education, and communication. Before we begin, I would like to do a land acknowledgement. The Office of Gateway resides on the traditional territory of the Anishinaabe, Haudenosaunee, and Neutral peoples. Under the Huron Tract Treaty signed in 1827, the territory is subject to the Dish with One Spoon wampum. Early June marks the beginning of Pride season. Gateway is an organization dedicated to promoting health and well-being for diverse communities that call rural areas home. Through strong partnerships, educational opportunities, Gateway helps foster conversations and initiatives that support health and inclusion for all. Our keynote speaker for this webinar is Jessica Linthorne. She is the President and Chief Executive Officer at the Nuclear Innovation Institution, NII. Leading a talented team dedicated to driving change for nuclear industry, advancing clean energy policy and economic development, and enhancing STEM education and trades training. Jessica has worked at NII since 2021, most recently as Chief Operating Officer. Prior to joining this, she worked in municipal government with a focus on facilitating appropriate growth. Her work has been recognized internationally and nationally through multiple awards, including as Top Economic Development Professional in Ontario in 2021. Dr. Karin Stephenson is the Director of Nuclear Research and Education Support for Nuclear Operations and Facilities at McMaster University. Dr. Stephenson graduated with her PhD in chemistry from McMaster University. She completed postdoctoral fellowships in radiology at the University of Pennsylvania and the PET Center at the Center for Addiction and Mental Health, University of Toronto. She has more than 20 years of experience in nuclear research, radiochemistry, and radiopharmaceuticals. Dr. Stephenson is the CSO for Canadian Nuclear Isotope Council and a board member of the Nuclear Innovation Institute and Canadian Mental Isotope Ecosystem. Dr. Leslie Walker earned her doctorate in social and economic sciences from the Vienna University of Technology in Austria in partnership with United Nations and Rotary International. Her research explored ethical applications of artificial intelligence in low-resource environments with a strong focus on healthcare, a vital concern for rural populations. She has been a passionate advocate for the innovation at Gateway. She contributes with her expertise in AI and its transformative potential for rural communities. Dr. Walker has officially stepped into the role as Executive Director of Gateway in May and has a strong commitment to developing strong partnerships and taking Gateway's work to the next level. Born and raised in Goderich, Trevor is the youngest mayor of the town since the early 1900s, elected in 2014. He's now in his third term, having served as councillor, deputy mayor, and now mayor. Trevor Bazinet's passion for teamwork and collaboration fuels his dedication to community projects, with particular focus on advancing healthcare services in Goderich. As a fervent advocate for rural healthcare, Trevor is committed to fostering partnerships that enhance health service delivery in the region. His role as mayor is vital in collaborating with local healthcare organizations, exemplified by the town's active participation in the Southwestern Ontario Isotope Coalition. To thank our ongoing attendees, we offer certificates at the end of each semester to those with perfect attendance to recognize your commitment to and involvement with this educational series by Gateway. As this is our last lecture of the season, we hope you have enjoyed Season 5 in the webinar series and hope to see you for the 6th. Throughout the lecture, we do encourage you to ask questions. They will be answered. Add your questions to the question and answer box. They will always be addressed.
Wonderful. Thank you so much, Grace. It's always a privilege to be surrounded by such brilliance and collaborative thinkers. So with that, I'll jump into my presentation, and then we'll move through the other speakers. Thank you, Grace, for getting us started. I'll just share my screen here. Okay, very good. Let's get started here. I always joke it's not a Zoom call until you ask for sure that everybody can see your slides. So Karin, I can see you on my screen. Can I have a thumbs up? We're good. Thank you so much. Okay, that's how you know you're in an active Zoom meeting and presentation. So thank you again, Grace. Thank you, Gateway. I always appreciate the opportunity to work with Gateway, to listen and to learn from you, but also to share what we're doing at the Nuclear Innovation Institute. As you'll hear me talk today about the Isotope Coalition, you'll have an appreciation and understanding of really how great my job is and how exciting the opportunity is for the sector and for our region of Southwestern Ontario. So with that, we'll dive right in. So we built this coalition really to understand that we have an exciting opportunity ahead of us. We are bringing together an ecosystem. We have diverse companies that are coming forward, public, private, academic groups. But the one thing that we have in common is that we see a vision here of an opportunity for Ontario, but an opportunity for Canada. And when we talk about isotopes, and as I go through the presentation today, it becomes abundantly clear that we have the medical research community, we have production, we have skilled workforce, we have what it takes to build this. And the opportunity ahead of us, although a long-term visionary opportunity, if we start today, we won't be looking in the rearview mirror in 10 or 20 years wondering what if. So let's keep that in mind as we go through the presentation today. So at the NII, we talk about the Clean Energy Frontier region. And when we talk about the region in which we work through a number of our portfolios, and the SOIC is one piece of our portfolio. So I will invite you to learn some more about our organization if you're curious. But we talk about this through the Bruce Gray and Huron lens. And so in our region, coming from Bruce Power, we're producing over a third of Ontario's electricity. One of the things that I share with people is if you go to OntarioGridWatch.ca, you can always see that live time of our Ontario grid and where the power is coming from. At any given point, you can see up to 60% is nuclear, coming from the GTA with OPG production, but then you're seeing about 30% of that Ontario grid coming from right here in Bruce County. And so that contributes to over $4 billion of the provincial GDP. So we know we have Bruce Power here in Bruce County as an anchor. We have a hub of innovation, and we have partnerships that are springing up across the region. The NII is one example of a real collaborative group of founding members that have come together to drive innovative thinking and collaborative projects forward. So the SOIC, coming back to that coalition, we have 4 co-chairs. So James Skoniak, he's the Chief Operating Officer and EVP at Bruce Power. I work closely with James as he's also the board chair at the Nuclear Innovation Institute. James is a visionary leader, and he sees this transformative opportunity ahead of us. So from his seat at Bruce Power, understanding how they can produce isotopes, but then also his vision of the community, the economic opportunity, the ecosystem development, and also sitting through some work with the Canadian Nuclear Isotope Council, he sees that we have this driving force, and we can be a real powerhouse of isotope production and process, and again, just leveraging the opportunity that they have ahead of us through that production. And so, we do know that isotopes are produced at Bruce Power. I'm going to talk a little bit about what that means and what that looks like. But just, to give you some of these numbers, 40% of global single-use equipment. And so when I think about that, you think any of those one-time syringe or swab or that piece of equipment that's opened and has been sterilized, 40% of those pieces of equipment have been sterilized by Bruce Power Cobalt-60. And so that's a pretty significant, you step back and you think that 40% is a significant production of Cobalt-60 coming from Bruce Power. 2 times lutetium-177 production started in 2024. So again, we're just the production and the volume of which Bruce Power is able to produce lutetium-177. And this is a isotope that can treat and fight diseases like prostate cancer. So with these two figures in mind, we're forming the SOIC. We have 33 partners today, but I will say we're in regular conversation with groups that come forward and are curious. They want to learn more. They want their organization to be involved and to understand how they can pitch in or be a partner. So it really is inspired by partnership. I want to take just a second back here and be really reflective on a really meaningful partnership between Bruce Power and the Saugeen Ojibwe Nation. Gazukaminakazawin means fighting cancer together. And it's a partnership between our Indigenous community, the Saugeen Ojibwe Nation, and Bruce Power in this production of medical isotopes. And it is an opportunity for economic reconciliation, and it's a really meaningful partnership recognizing that isotopes are fighting cancer. They are helping sterilize equipment. In lots of cases, they're saving lives. So this is a meaningful opportunity. We also acknowledge that the isotopes produced at Bruce Power are being produced on the territory of the Saugeen Ojibwe Nation, as that's where the site sits. We have supportive municipal partners as well, and this is another big component towards our success. Mayor Bazinet, I know, is speaking today as well, but people like Mayor Bazinet, leaders like him, leaders in elected official seats or senior staff seats at municipal government, these people are helping us understand, again, connecting and convening, bringing what we need together to have a really strong coalition and a good runway to move this forward. So I mentioned, James Skoniak as a co-chair. I'm also really fortunate and privileged to work with Councillor Theron Solomon. And Councillor Solomon represents a Nawash community and is very involved with the Gazukaminakazawin partnership. And so, again, we're really proud of this relationship. And we know that there's an opportunity here looking forward, how we can work together today to see the success in the future. So we have key infrastructure, and I want to spend a few minutes talking about that. So we know isotopes are produced at Bruce Power. I shared with you a couple of those stats. We know that rural hospitals are important. We have a strong relationship with Bright Shores Health Systems, also getting to know our other hospitals in the Bruce Grey and Huron region, building those relationships to understand what some of those gaps might be or where there might be advocacy alignment. And so we're really proud of those relationships. Innovation Hub, that's certainly a strong part of that infrastructure. And we are pleased and proud as the Nuclear Innovation Institute to play the role that we play in delivering the Southwestern Ontario Isotope Coalition, but also just advancing a number of initiatives that we are able to do here for our founding members. It's quite an exciting time when you bring these pieces together. It's a really exciting time. It forms that strong coalition, working with the Canadian Nuclear Isotope Council. What we have here is Southwestern Ontario, and that's wonderful. There's a Central Eastern Ontario isotope group that is forming as well. But we know that this Canadian piece is really important, that national piece. One of the things that I remind people, it's not necessarily, this isn't to have, if we can take the production of isotopes and work with it here and produce here in Ontario, that's good. If we can do it in Southwestern Ontario, that's great. But the opportunity here for Canadians, for Ontarians, this is really about being proud Canadians. It's about leveraging that production and doing the right thing with it. And we know the right thing by producing these isotopes and working together through this ecosystem. It is about finding ways to whether that's diagnosis, and I know Karin's going to talk a little bit more in her presentation about how she uses medical isotopes, but it is about fighting cancer. It is about those treatments that people need to fight cancer, to save lives, to sterilize equipment. So, these strong coalitions are really important, and we continue to build those relationships every day in the work we do. Research and education, massive piece of infrastructure. incredible relationships. Karin, as noted, is on the board at the Nuclear Innovation Institute. I'm grateful for the relationship with Karin and the work she does at McMaster. I'm looking forward to hearing her talk, because every time she speaks, I learn about 6 more things. So it's a real privilege to work with her as she represents McMaster. But we have relationships with Georgian. We know they have a strong presence in Owen Sound, which again, this Clean Energy Frontier region, Bright Shores Health System, including Bright Shores Research and Innovation Office. So getting to know that organization and their strategic goals and priorities and how we align. Gateway, as I opened the presentation, it has been such a privilege getting to know the team at Gateway, to follow some of the research initiatives, and where there's partnership, the NII is looking forward to continuing that with you. And building relationships with Western. And again, these are just naming a few, but as the coalition evolves, we are starting to see more of these academic partners and research institutes come online. So, you know, I look at these 5 boxes in front of me on this slide, and when we think key infrastructure, we really do have what it takes right here to be able to drive this ecosystem forward. And so this is a great graphic that I certainly appreciate when we think, okay, an isotope ecosystem, you know, what is she talking about? What does that mean? We know that they're produced at Bruce Power. We know we've got some research experts and some curiosity. We at the NII, we're also driving some workforce initiatives. So let's continue that conversation. You know, what are the jobs in isotopes? There's processing, there's packaging, there's logistics. There's a number of roles that we need to learn more about and start to fill, and start to spark that curiosity through our kids and our youth, because there are exceptional amount of career opportunities in nuclear and isotope production, and logistics is one piece of that for certain. But the skilled trades and training. So again, who are these people, and how do we help them move them into careers that can support this development in this ecosystem? Economic development, certainly my background in rural economic development, I look at a graphic like this, or I look at that infrastructure, those 5 boxes I just shared, and that's why I get so excited. Because from an economic development perspective, assessment growth and job creation, how do we help our communities be sustainable and be strong, so our municipal governments have that assessment growth, so they can continue to fix roads and bridges, they can build new recreation centers, they can maintain new trails, our waterfronts, all of these beautiful amenities that we have living in the Bruce Grey Huron region. You know, we choose to live, work, and play here for lots of reasons, but when it comes to that community piece, economic development's a real key component. Not to mention, you know, the job creation. So, you know, what are those good paying jobs, those stable and secure jobs? When we talk about nuclear broadly, and it's a whole nother conversation, but when we talk about nuclear broadly, you know, we see the longevity of Bruce Power with major component replacement underway now, potential for a Bruce C, so a new nuclear build. That may be a whole nother presentation, but you know, this notion of these assessment growth and job creation, which creates economic development, it's certainly exciting to look at it through a lens of isotope production. Transportation, you know, I roughly talked about logistics and shipping, and these isotopes have lifespan to them. They need to move, come out of the reactor, they need to be packaged, they need to move so that they're ready to be processed into drugs. Then those drugs need to hit our patients. And so this transportation piece and understanding all of those players along the way, this is a really important part of what the coalition can tap into and get to know, again, who are those local assets and what are those regional assets that we can be leveraging as part of this ecosystem development. Advocacy and policy, so for patients, for rural hospitals, for rural healthcare. You know, I will share that my family, my husband was diagnosed with some skin cancer last year. We live in the city of Owen Sound in Grey County. The hospital in Owen Sound is the central hospital for Bright Shores, and he still had to travel to London to receive radiation treatment. And the city of London is about 3 hours from our home. So for about a 6-week period, it ended up being 6 weeks total. He was traveling to London Monday to Friday, had to stay there, come home on weekends. And the impact of that on family is great. The impact of that on him and his healing is tremendous as well. and not to mention that the financial cost and the accommodation, and how is he when I'm at home raising our children, and life continues. So the fight against cancer and the fight against or the fight for rural healthcare, quite frankly, has never been more personal. And so I share that with you today to say, when we think about advocacy and policy, rural Ontario does not need to fall behind, and nor should we. And so we at the NII have aligned. We have a strong advocacy portfolio. If you know my colleagues at the Nuclear Innovation Institute, you'll nod your head. I work with some of the most brilliant and creative minds in this organization, and it makes me certainly an incredibly proud leader every single day to come to work. But this advocacy and policy work we will continue to do. The most important message when I think advocacy and policy is, it's not us in a silo. It's us working with our hospitals, working with our researchers like Gateway, working with our academic partners like Dr. Stephenson, understanding what those needs are, compiling that message, and bringing that forward to the province in whatever the case may be, to have a united front. And so I'll share, I'll move on from that, but just to last note on that slide, this is all work that the NII continues to do, and we're really proud of it. So Southwestern Ontario has come to the table. You can see here a number of logos. I won't read those out, but this is a snapshot to say, these are our partners. This ecosystem is building, it's forming, it's advancing. Our team is working towards to publicly releasing a review of those regional opportunities, and we have feedback from all of these groups on what those opportunities are and how we can advance together. So this coalition is taking shape in an incredible way, and it's something I'm significantly proud of. So our 4 co-chairs, so it's myself, Councillor Theron Solomon, James Skonyak, as I mentioned, and our certainly last but not least, Mayor Ian Boddy. Mayor Boddy with the City of Owen Sound is a strong advocate for rural healthcare, a strong advocate for economic development. He gets the credit for calling one day saying, how can we help with this isotope portfolio, and what should we do to get partners to the table? And from that conversation, we formed the Isotope Coalition. So again, we see this alignment, and we know we have what it takes to be that key isotope ecosystem for the region, for the province, for Canada, and truly around the world, right? We go back to that 40% of those single time use are being that's where the Cobalt-60 comes in from Bruce Power. So, just again, a significant opportunity right at our feet, and we can really run with this with our partners, and the emphasis on that collaboration and the emphasis on partners cannot be understated. So I noted we're about to release a review of regional opportunities. Here's a bit of a snapshot of what that looks like. We know that we have that infrastructure, but let's continue to build that supportive infrastructure. What does that look like on the ground, and how can we do that together? How do we enhance rural healthcare delivery? So I'm not the expert at that, but I will call my friends. This is when we call our partners and we learn and we consult with each other. We want to look towards enabling policy frameworks. So where are there policy pieces that we can be driving together? And we want to remove barriers that might be between industry and academia. And so where is there that opportunity to bring those partners closer together, and the Isotope Coalition can act as that conduit. So I'm just about ready to wrap up here, but we are looking forward to launching that regional review. As I mentioned, we'll be launching it at the CNIC, the Canadian Radiotheranostics Leaders Summit. That's coming up just in a couple of weeks now. Our team has supported the planning of the student track program, which is really fun. We did that last year as well. A good opportunity for some of the students at that summit to be engaged, particularly with us as leaders in rural Ontario. So it's certainly an exciting program. We are always onboarding new partners. As I mentioned, we'll go out, we'll make delegations. We're happy to have Zoom calls or any conversation, share material, help people understand what it is we're doing. Because it's, as you can tell, it's not nothing. It's a pretty exciting time, and it's a pretty powerful opportunity by bringing everybody together, aligning advocacy, and just that continued drive of collaboration. So So with that, I'll invite you to be in touch as you'd like. You can certainly learn more about the NII by visiting our website, but particularly to learn more about the Southwestern Ontario Isotope Coalition, you can check out soic.ca. And then my contact information should be available certainly today through the webinar, and I'd be happy to speak with anybody about this or about other initiatives that we're working on. So with that, thank you very much for having me today.
Okay. Perfect. I guess I'll just hop on. And so Karin, I guess you're also doing some presenting, so that would be wonderful. And then we'll go into more of the Q&A.
Sure. I just wanted to kind of I'll start with thanking everybody for inviting me today. This is my favorite topic, and I love talking about isotopes. I could talk all day long about them, but I think I have like 5 to 7 minutes is what I'm given to kind of give a little bit of an overview of what is an isotope and what are we using them for. So I'm going to share my screen and just have one side, because in this field, a picture is worth 1,000 words for sure. And there it is. Okay. Continue. There we go. Okay. Can everybody see my screen? Give me a thumbs up. That's good. Okay. Fantastic. So, radiopharmaceuticals and theranostic pairs, and Jessica's kind of danced in and around some of it, so I'll get into the weeds a little bit of the science of it. So a medical isotope is just a radioisotope that's unstable. We use these isotopes, and as they decay into a stable atom, they release different emissions and particles, and we're going to use them for nuclear medicine in order to help us diagnose and treat disease. So I'm going to start with the picture because that's probably what everyone is focused on first anyways. Your eyes get drawn to the photo of the patient. So this is actually quite an old image now from 2018. I guess not super old, but the field is moving very fast. So this was actually the image of the year at our Society of Nuclear Medicine meeting that's international. And what you can see here is a patient with a lot of red dots. And those red dots all represent metastatic tumors. So this patient is quite ill, probably already been through 2, 3, maybe 4 different treatment options. Probably this is the last option. And they took this treatment of lutetium-177 PSMA. So if you look in the one image with all the red dots, and you also see a number at the bottom there that says 967. So that's actually a blood marker that we use to help diagnose and know when where we are at with the different treatment options open for prostate cancer. And if you look at the next one, that's about 3 months later. So this patient underwent probably between 4 to 6 different treatments of what we now call Pluvicto. And then you can see his number dropped. So there's the nice thing about PSMA and prostate cancer is that we can use PSMA as a blood marker to help us as well as the imaging. And we use both tools when we're involved in nuclear medicine, and the oncologist will use that. So I'm a chemist, so I have to show you the chemistry a little bit. So if you look up to the top corner, what you'll see is it's actually a tiny little peptide, and it's made up of 3 different amino acids, and that's what is made up of all of us. All our proteins are made up of amino acids, and that's what makes our muscle and everything. So we are using these 3 little amino acids to target specifically to the prostate cancer. So a prostate cancer cell will express millions of these receptors, and it'll allow these to be able to go and attach to them, and then they get pulled into the cell. What it's pulling it in with it is the little radioactive symbol. So we call that a chelate, and what it does is it's just a big ball of atoms that's holding the radioactive atom in, and it's holding it attached to this little targeting agent. So it all gets pulled into the cell selectively. We inject it intravenously. It circulates in the body for probably about an hour, and then it's already found where it needs to be because it's a small molecule. Larger biomolecules and targeting agents have to circulate for a longer time because they're like a bowling ball. But these little guys go in pretty quick, and then they stay inside. And what it is it's allowing the lutetium-177 to do the damage to the DNA so that the cell selectively dies. So we're able to then, that's why we had all those black dots, and then we have no black dots, or red dots, sorry. And what you'll see there is what the concept I wanted to share is theranostic pairs. So lutetium-177 doesn't provide us with a nice gamma ray for imaging. It does a very terrible job of that. And it's also not quantitative. So it doesn't allow us to know exactly how much is there. It's just a yes, no. So we want to use another isotope called gallium-68. And this is where it's a just-in-time industry, especially. It's a 1 hour half-life. So we are hustling from the jump in nuclear medicine to get this scan done. So we use that interchangeably. So we use the gallium-68 and we just swap it out with the exact same molecule. And we use that to diagnose and decide on how much we're going to give of the radiotherapy. We then make the same drug, swap it in for lutetium-177, quite likely is probably come from Bruce Power. And then we package that into the same, and we treat the patient in the same way. And then we go back and do another image with the other version. So we call this a theranostic pair. It's a play on words, a therapy and a diagnostic. So a theranostic pair. So how do we make these drugs? Jessica said logistics is important. It's top of the line importance, I would say. So when we're making a radiopharmaceutical, I would say the rule of thumb is we have about 1 half-life to get it there. So half-life is the amount of activity that is lost in a certain amount of time, half of it. So we start with a target material, and we'll decide this depending on how we're going to make it. So now we're going to look at the linear line on the screen. And so we start with this target material, and it's for lutetium-177, it's ytterbium-176. When we put that into a neutron environment, it absorbs a neutron because it likes them. It becomes ytterbium-177, and then that decays because it's unstable into lutetium-177, and then that decays by emitting a beta particle, which allows it to treat the cancer cells. But we can make medical isotopes because we use gallium-68. We're using lutetium-177. In fact, if you go and have a stress test, you're probably being injected with technetium-99m, which is still the most widely used medical isotope in the world. It's 80% of diagnostic nuclear medicine. So if we make all kinds of different isotopes, and there's many that are emerging, and that's exciting. So we have different ways to irradiate, and I've got sort of all the different options to the side. We use linear accelerators, we use research reactors, we use power reactors, and we use cyclotrons. And they're all important because depending on what you want to make, the best way to make it might be in a different way. So all different irradiation and production methods are really important to the ecosystem and to providing patients with the best treatment planning and treatment option. Once this target has come out of a reactor, it is by no means ready to be used. We have to process it. We do that in hot cells, which is, I know, something that is being developed also in the county, which is great. We have a series of hot cells here at McMaster and different ways to use them, but you have to process it in a big hot cell and decan it and get it ready to be used. Then, this is my actual background, is in the radiochemistry and drug production. Now we have to put it into the drug so that it looks like the target that's up on the right-hand side. So now we have to do that, but we have to do that in a couple of different ways. We have to do that in a clean room, and we do it in a clean room because we want to make sure we're not we're doing this IV patients with bugs that will cause other problems. The last thing these patients need is another problem. So we have to do it in a clean room, but we also have to protect the worker. So these radiopharmaceutical clean rooms are quite special, state-of-the-art facilities. And if you get to see one, they're pretty cool to see, I would say. And so everybody will be fully gowned, protecting the patient. And then they have to use hot cells and remote manipulators, and that's protecting the worker. So we have to have both people being safe in this process and going forward. So we produce this drug, and then it's shipped to the hospital where we have a nuclear medicine technologist, and they administer it to the patient. And it's interesting a little bit about the technologist side. It's often, I think, the unsung hero a little bit of the process. And that in Ontario, 50% of our nuclear medicine technologists are going to retire in the next 10 years. And we are not going to have people to administer these drugs that we want to develop and treat all the patients. So it's a great opportunity for jobs if anyone's looking. There's only one place in Ontario that you can train right now, which is at the Michener Institute in Toronto, but we're developing a virtual remote program at Mohawk, and the nuclear part will be done at McMaster. But either way, so this is the process. It's quite long. So when I say 1 half-life, so for gallium-68, I said it's 1 hour. So that means that the radioisotope has to be at the hospital before you can start. The patient is usually on the table when you're making the drug. When you're making something like lutetium, you have 7 days. So you have time. I say rule of thumb is 1 half-life. So you have about 7 days to make it, ship it, process it, and do all of the things that you need to do in order to get it to a patient. So it's complex. I've worked with isotopes. Carbon-11 has 20 minutes and that's a hustle. And then we have some that are 2 hours, and we have some that are 10 days. So there's kind of a variety, and you want to match the isotope to what you're trying to do and with the patient. And that leads us to this personalized medicine, and that we're matching the right treatments and the right diagnosis for the patients. So I'll leave it at that, but if anyone has any questions, I could dig into any part of that.
Thank you for presenting. I'm just going to have Mayor Bazinet and Dr. Leslie present next, just say a couple words, and then we can move into more questions and answers.
Okay, Leslie, do you want to go first, or do you want me to?
I might as well go first because I've got some kind of things to tag on with Karen's and Jessica. I mean, it's interesting because when we first did the session, there's some kind of like, well, you're an AI, why are you even who let you in this room kind of thing. And I just kind of fumbled my way in. But there is quite a lot of complementary things going on here. Even Karin, you were talking about the half-life and the need, for instance, for supply chain optimization. And so, for instance, that's something that AI is very proficient in. Also in isotope production, imaging and diagnostics, AI's ability to analyze these. And so clinical support, radiopharmaceutical design, kind of the list goes on and on of ways that they can be complementary. As well, I would say, AI is also just very energy hungry. So, you hear about some of the negative implications about AI, which is very valid in terms of also in the global context we exist in, which, climate change and the energy crisis, is legitimate. And so, how it can be complementary in that way. And then also, I would say there's a significant number of ethical parallels between the two of them. You have both of them being dual use, the possibility for extreme good, but then also catastrophic harm or a possible existential threat. And I know sometimes we shy away from having conversations like this because it is a bit of a tough topic, but the only sustainable form of AI is ethical AI, and it's the same with nuclear. You also see, for instance, the implications to inequality with both. With AI, you have the companies, big tech getting bigger, or the countries that leverage AI getting, wealthier and having data advantages that other countries don't have. And then kind of with nuclear, you have this club of rich, powerful nuclear nations kind of thing. And so what are the global implications associated with some of these things? And then you've got irreversibility and path dependence. And so not all of this is necessary to discuss in, such a short lecture, but in terms of the similarities for good, for bad, with AI and nuclear. And, as Jessica said, like having smart people, creative people in a room talking about this and discussing it truly is the way forward. So I digress with that, but if anything comes up in the Q&A, I'm happy to discuss.
Okay. And I guess from my point of view, being a municipal leader and a mayor of a small town of a population of 8,000, it's important to stay informed about the current trends and resources, right? And the innovative solutions being used. And if we're not, building those relationships with the people of Bruce Power and Nuclear Innovation Institute and Georgian College, and the list goes on, Gateway, of course, in our own beautiful small town, we're not doing the people of our community and the youth of our community any service, right? And it's about making, for me, really, the big thing for me is youth engagement is a big piece of this, right? And workforce development and making them aware of what skills can be provided to them to, have a good career, right? Be able to make some decent money, continue to live in the small town that you were born and raised in. You know, unfortunately, there's that thing where people think when they live in a small town, they have to leave that small town and go to the big city to find a well-paying career. But we have so much around us in Huron County and Bruce County and Grey County. And just because, you know, Bruce Power is in Bruce County doesn't mean that the town of Goderich doesn't build those relationships with Bruce Power. And I've seen a huge benefit with those relationships being built with myself and people like Jessica and Chad Richards and James Sconiak. Jessica and James both spoke at my mayor's luncheon a couple weeks ago. And, you know, I had a lot of people approach me after, and I know Jessica and James did as well, saying how great of an event that was, right? People that didn't even know what a medical isotope was. Right. So it's all about learning. And, you know, I learned, first time I learned about it was a couple of years ago at the Clean Energy Frontier Summit at Cabo, and James Sconiak was up speaking about it. And I'm like, what is this? Right. So I walked over to him after, gave him my card and said, I need you to come to town of Goderich and do a delegation in front of our council. And that's what spearheaded all of this. And now I'm on the Southwestern Ontario Isotope Coalition. And, you know, Jessica mentioned Mayor Ian Body. Great relationship with Mayor Body. Actually, he called me last night at 6:15 as I was driving home from a massage and wanted to run a couple ideas by me, right? So that's what it's all about, building relationships, collaborating, and learning from each other and helping each other. So I'll just leave it at that for now.
Awesome, that's really great. Now we're gonna head into some questions. So we have a question that is, how is it used or expired or unused material disposed of? Is it dangerous to the environment? This is from David. Jessica or Karen, whoever feels most fit to answer that, go ahead.
Sure. I'd love to talk about that. I like this topic too. So one things when we talk about waste with respect to medical isotopes is most of them will decay because they have a half-life. So if you have a 20-minute half-life, within 10 half-life, there's nothing left. It's gone. It's just decayed. It's down to a stable isotope that can be disposed of or in a normal chemical way. There's nothing radioactive about it that's left. But I think there's a conversation to be had when we're looking at what is the emerging, what is the next radioisotope. So I was involved in developing a project around a new drug around actinium-225, which is another emerging isotope in treatment options. It's very special, but it came from legacy waste sources. So when we first started working with that, we were buying it from the Department of Energy in the US, and it came from legacy waste. And now we're using it widespread all over the world, trying to be able to treat and new ways to treat different cancers. So I would say let's hang on to those things. And I bet if I wear my research hat, we'll find a way to use them.
Awesome. And Leslie, I'm going to give this next question to you. It's just regarding Gateway. They said, Grace did a wonderful introduction. Great to see high school co-op students so involved in Gateway. Are there other opportunities for students to complete a co-op with Gateway? And I feel like you're best fit to answer that.
Yes, definitely. We love co-op students. We love university students. Really, I do think that the ability to do local research and local research, but the ones that we can scale more broadly, is one of the key benefits that we offer at Gateway. Like, of Grace, you know that I think you're wonderful, and I think co-op students really are the a tremendous benefit for all organizations. Like, I'm a really big advocate for them. One, the price is right, and two, right, the energy that they bring is really wonderful. And so if anybody is interested in being a co-op student at Gateway, and potentially other organizations, I recommend reaching out to the info@gatewayruralhealth.ca email address, and we will set something up. But I know we have meetings as well with local high schools as well.
Yes, and I do really enjoy the co-op here, so I do recommend it if anyone wants to do a co-op here. And then we have a question from Michelle. Does the fact that Goderich Municipal Airport is a Canadian port of entry and equipped to handle small jet have any impact on transportation of the isotopes globally? Again, I'm going to give that to Karen or Jessica. Jessica, maybe you want to deal with that one because you talked about a little bit about the regionals.
Sure. Yeah, I saw Mayor Bazinet came off mute. I thought we were gonna have to rock, paper, scissors there, and who gets to speak first. I'm just kidding, Mr. Mayor. I'd always give you the microphone first, except for today. I'll take it. So, before I actually answer the question, Grace, I do want to just applaud you. It's interesting, when we started the session and we were still in test mode, I thought, oh, I haven't met Grace. She seems, really, really smart and really bright. I had no idea you were a high school co-op student. So I just want to start by saying I'm incredibly impressed. So thank you for the work that you're doing, and yeah, keep it up. This is important stuff. So good for you, and good for Gateway, because it is important to give this opportunity to our youth. So the question with regards to transportation, so the airport, the port as well. So yeah, great question. And I will say that Mayor Bazinet has been a champion at the table, continuously putting his hand up, reminding Bruce Power and reminding the logistic partners that is an option. It is available. So that conversation continues, and likely down the road, as we, again, get to build this coalition, get to know those partners and that process, that may be something we do come and tap on the shoulder for some support. So it is absolutely on our radar and has been raised in discussion. But Mayor Bazinet, I don't know if you'd like to add to that.
You stole all my thunder, and no point even doing rock, paper, scissors now. But yeah, we're always having conversations, right? And a gentleman by the name of Jane Scognac is probably tired of hearing me mention it to him, but we need to continue to mention it, and he understands. And we are hopeful that, a port expansion will happen here in the near future, which will be a huge benefit for the town of Goderich and the likes of Bruce Power and everyone else for that matter. So those conversations still continue to happen.
And for other industry too, I'll add, Mayor Bazinet, with regards to logistics and transportation. And so I'm not sure, Karin, if there's other comments, or if you have, there's lots of regulatory things that I'm not necessarily versed in. So maybe Karin, I'll let it pass to you.
Well, I think that one of the most surprising things that I find when I'm giving tours and talking about medical isotopes and the topic of logistics comes up is people are very unaware that most medical isotopes are shipped on passenger planes. So anytime you're flying around the world, there are probably isotopes in the belly of your plane and you don't even know it. And so it is the main way. In fact, when COVID hit, it was the main impact. Like, it was huge. We actually didn't shut down here at McMaster. We make I-125 and treat 70,000 cancer patients around the world, and we couldn't get our isotopes shipping. We were operating, we didn't shut down, but we had a really hard time getting our isotopes out. Although I would say that's always an opportunity for innovation. And we talked about drone delivery, and we worked with NII to do care by air, which is a way to deliver isotopes in a different way. But there's lots of regulatory hurdles. We're shipping radioactive material. There's lots of licensing limitations. All of that is overcomable. But most often it's that this is a just-in-time industry, and you need passenger planes because they're going all the time. So there's just the sheer volume of passenger planes. So even in local for us in Hamilton Airport, it's limited. We go to Toronto because we need the number of passenger planes. So you got to get there first, and then it will go. But,
yeah, and the benefit that the town of Goderich has with our airport is the size of the runway, and we do have small jets that are allowed to travel into our airport and leave our airport. So there has been that conversation as well in regards to transportation, if ever need be, right? We put our hands up and say, hey, don't forget about us, right? So yeah.
That was a really great question. Mayor Bazinet, just while you're still speaking, I have another question for you. You've attended various healthcare meetings and conferences to understand and advocate for health in rural areas because that's important to you. How do you bring this knowledge back to the people just living in Goderich?
Great question. So yeah, I have attended quite a few since I became mayor, and it's important, like I said earlier, to build those relationships. But the information, how I, communicate that back to the public here is I use my social media platforms quite a bit. It can be a positive in regards to live videos, just letting people know. But as part of our strategic plan here with the town of Goderich, we have had 3 town hall sessions as well, where it allows the public to come in and ask council questions in regards to that. But it also allows us the opportunity to use our voice in a different manner than in a council meeting format, right? So been able to express, the relationships and the conferences and the things that we're doing. You look at Nuclear Innovation Institute, for example, a great relationship with Gateway going on. I sat in on a meeting with them when they initially met in the town of Goderich, and just some of the things that the Nuclear Innovation Institute does in regards to the youth engagement piece with the Science Olympics, right? So if I don't hear about it, if I don't hear the person beside me talking about it, which I was fortunate enough to hear, then I'm saying, what about our high school students here in the town of Goderich? Why can't we go in the Science Olympics? Then we have NII looking at me going, well, what do you mean? Why can't you? So that's the whole thing, right? So we end up sending some students there and they win, right? And I'm going to brag and brag and brag about how amazing our students are here at our local high school. But that's just a small thing in the piece of the puzzle, right? It goes so much farther in the building relationships. I've met so many wonderful people. And even in regards to every municipality right now is dealing with lack of physicians. So physician recruitment, it's a tough job right now to navigate through, because before you used to be able to sell the lifestyle of your community, right? But now there's a cost to this now that wasn't involved before. So what we're doing now, and me working alongside with Gateway, is I'm providing any physicians that we're looking at recruiting a tour of our town as well, and trying to sell that lifestyle, taking them out for lunch. I'm born and raised here. I know probably quite a bit about our town and our industries and all those things. And the first question I asked the physician that we're looking to recruit is, what are your interests? I want to know what they're interested in, because I don't want to tour them around an area of town that they're not interested in, right? So is it libraries? Is it recreation? Is it the schools? Like, do you have young children? What's going on? Housing? What type of house are you looking for? So those are all things that we discuss. And then, of course, I'm going to show them the world's largest salt mine if the opportunity's there, right? So we do have that in the town of Goderich, and we need to show off those things and make people aware of it. Our waterfront is one of the gems of our community, 1.8-kilometer boardwalk. Our historic downtown that we're currently digging up because of aging infrastructure. It's over 100 years old. But if you were never been to the town of Goderich and you came into our town, you would be blown away by the history and the beauty of it. And you can actually see the sunset twice here if you're fast enough, right? So, but in saying that, I've made a lot of relationships. I brought, a lot of communication back to the town in regards to how we can get involved, and we're going to continue to get involved. Our relationship with NII and the Southwestern Ontario Isotope Coalition is top notch right now. I really believe that. And there's an opportunity where I could possibly become the co-chair of SOIC as well. So we'll wait and see. I'm looking at Jess when I say that, but yeah, those are all key things that we're doing. And communicating back to the public is so important, because obviously in my role, they want to know, okay, if you're going to a conference, obviously that's costing money. So what information are you bringing back? What resources are you bringing back? So those are some of the platforms that I continue to use. And people that know me know that I'm very open and transparent and approachable. So connect with me anytime.
Awesome answer. We just have time for about one more question. Jessica, you really do have a remarkable career in driving economic development in municipal spaces. How do you bring that knowledge in cultivating regional economic development through the Southwestern Ontario Isotope Coalition?
Thank you, Grace. Great question. I'm really proud of my my experience in rural economic development. My entire life, I can say, I've been passionate about community. And if there's one word that, I would put at the very top of my resume at any time, it's community. Because I know that community is what makes our lives so great. From a community development and economic development, I talked earlier about that assessment growth allows municipalities to build rec centers. It allows municipalities to build, Mayor Bazinet just said like 1.8 kilometers of boardwalk, or I hope I'm getting that number right. But that funding, that assessment growth, when you have new businesses come to town, or you have entrepreneurs set up shop downtown, it creates that vibrancy. People go and they grab that coffee, or they buy that sweatshirt because it's cool. Or, if you're, you go downtown and do your local shopping. And I'm a big advocate for living well in our communities, and that it comes kind of through all of that approach. But and then also being from a rural community and growing up in a rural community, and I was like many youth, and I couldn't wait to get out of here, right? Like I couldn't wait to get out of the area. And I left for a little while in Waterloo region, did some really cool stuff, had some cool experiences, and then I couldn't wait to come back. And so, you know, I work with a number of people that have a similar story from the area, left, and then had an opportunity to come home. And so that's economic development as well, right? That's that attraction, that workforce development. So when I kind of come back to your question, Grace, and I reflect on, you know, the how or the why behind that collaborative approach, it's because I know the power of relationships. I know the power of data. You know, I'm sitting at a community in Port Elgin and there's a Starbucks, you know, a short walk away. I can tell you that Starbucks was not there a handful of years, and probably 10 years ago, if you said, hey, do you think a Starbucks would come to Port Elgin? I'm not sure. You know, why would they? How could they? But the Holiday Inn, as another example in Port Elgin, and I'll just use those examples because I can see them from my office, but these investments happen because of data, and data that is pulled together from, whether it's the NII from our team, we do a lot of data and economic impact projections. We give that data to our municipalities. So, you know, Mayor Bazinet or to Huron County Economic Development, we're able to provide them data. They build relationships with investors, or to Mayor Bazinet's point, you know, potential residents or potential physicians in that case. We bring that data, we talk about what's happening here and that livelihood and that assessment growth and that job creation, and all of this happens with the right approach, with the right time, with data informed, building those relationships, and then what we see is that investment. Then we see the Holiday Inn pop up, or a new Food Basics, or a Starbucks. Because those investors feel confident in coming in and doing that. And you know, we see then those empty storefronts downtown, because now that business owner says, geez, there's an economic impact here, in the case of my work, because of nuclear. The clean energy sector contributed over $233 million to municipal taxation in 2020. So in 1 year alone, Bruce Gray and Huron, upper tier, lower tier, saw over 233 million. Because of the clean energy sector. And I could go on and on with data points, but we have some of those data points about what does that mean for local retailers. I come from a family of entrepreneurs, and you know, my mom and my sister own a small business in the community of Saugeen Shores, and it continues to thrive because people shop local, because we believe in entrepreneurs, because we have set an environment that promotes that. So I'm passionate about it, Grace. I think that's the first answer. And the second answer is, you know, we build relationships and we inform those relationships with data. And when we work together, when we're collaborative, and, you know, like the SOIC, when you put all that together and you drive that with good, strong leadership and vision, I mean, you know, not to sound too cliche, but wow, anything is possible. It really is. So I'm really grateful for the opportunity today.
Awesome, and I completely agree with that. I'm going to start wrapping up this webinar for today. I want to thank all of the presenters. Each one of you did a great job. Doesn't matter how little or how long you spoke, you did great. I'd also like to thank our sponsors, because without them, this lecture series is not possible. McGee Motors, Goderich, Huron Lighthouse Money Management, Goderich, DeJager Town Square IDA Pharmacy, Goderich, Zayers, Goderich, CIBC Wealth Management, Libro Credit Union, and Tucker Smith Telecommunications. Again, Gateway is a nonprofit organization with a charitable status, and we greatly appreciate any support we receive. On the 25th, Gateway is hosting a Senior Technology Summer Camp on Wednesday, June 25th, 2025 at the Goderich Legion, Branch 109. We encourage people to attend this event and get one-on-one tech help and learn from their peer mentors. Gateway people will be there. We're taking a break this summer. We'll return September 9th, 2025. We look forward to seeing you there. Thank you again to our panel, sponsors, and especially you for tuning in, and we hope to see you in September. Thank you, Jessica Linthorne, Dr. Karin Stephenson, Trevor Mayor Bazinet, and Dr. Leslie Walker. Thank you guys so much.
Thank you.
Thank you.
You.
Thank you, guys.